I'm Dr. Leo Powers. I'm in Plover, Wisconsin, and it's at Powers Chiropractic. And so today we're going to talk about how to strengthen a muscle the most strongest, best way to do it. And the reason why I say it's the best way to do it is because I'll fill that in the middle, of the speech. But basically, the Chinese medicine, the acupuncture meridians start from the chest. They go down to your end of your toes, go back to the chest, go out to the fingers, go up to the head, come back to the chest, and then keeps going. And so there are 6 main meridians in the body. There's 2 here, 1 here, 1 here, 1 here, 1 here, and then on the foot there's 2 here, 1 here, 1 here, 1 here, 1 here. So there's 6 on each one. And so with this technique, because you're working on the metatarsals and the metacarpals, it'll unlock the block in the meridian flow tied in with that muscle. And so it's a new technique that hasn't been used a lot because people don't know how to do it. So you have to be able to do the cranial work in order to do that. The category 3 ties in with the endurance, and so you have to get motion back in here to get that function up. So I'm going to talk about a case study where we worked on the adductor muscles. And initially, I'm going to talk about a case with a family friend. They got adjustments ongoing, and they were when they went to the urologist, because they had one of their testicle didn't come down, and it didn't come down because there was mechanical stress in there somewhere. And then the urologist doctor said that it might come down by 5, and if it doesn't come down by 8 or 10, it's not going to come down. So I continued to work on this patient regularly, and I learned about it's called the sphenomax, and it has to do with the ankle area here, and then it has to do with the ankle bone and the lower leg area there. And the lower leg bone actually moves with the maxilla, that's the upper mouth area, and this bone here moves with the sphenoid, which is the center bone for the head. That's this yellow one in here. That's the sphenoid, and the maxilla is the upper mouth, upper jaw. There's a lower jaw, upper jaw, but the upper jaw, the maxilla. So I learned how to adjust it on this patient. And so I was checking his motion in his ankle and his foot bones in here, and I could feel it was restricted there and restricted over there. So I put some motion back in there, not a lot, but enough to get motion in there. And then I checked the indicators on the back of the head, and it showed up it was tight. So then I adjusted it, and then I did the second adjustment where I wiggled this one a couple days later, and then adjusted on the other side too, and then I got tension on the opposite side. So then I adjusted that, and then Dad said that after the adjustment that the patient came back 2 weeks later and said it came down. They don't want to tell him or me that they wanted to make sure it was going to stay down. So it did stay down, and so that's how the adjustment happened. And when he was 5, we did do taping on that lower leg area right in here, and that has to do with the tibia fibula motion in here, and that has to do with the adductor, because when you bring your leg in this way, that adductor gets contracted, and so if this is not intact, then it's harder to adduct in related to that, and that can impact balance and not hearing, but balance. And so that's how that was worked on. And so if you understand that this is the hand bone, this is the foot bone, and the foot in Chinese medicine is yang, and the hand is yin. And so within the yin of the hand, there's a yang. So the thumb is the yang of the hand in the hand, and then the most yang of the yang in the foot is the 4th, 5th connection down here. So if you adjust the 4th, 5th connection on the foot, and the 1st, 2nd connection in the hand, and then adjust the head on the yang side, for the people that know how to adjust it, then you can do 4 extremities in one. And so that's a very powerful acupressure treatment for a muscle. And so once I learned how to do that, I let my patients know about it. And so this patient came in, and then he had a lump on his testicle. His testicles were down, but he had a lump on his testicle. So I worked on him, and he wanted to see if I could help him versus go to somebody else that's going to do something else. So anyway, so within a few visits, his lump went away, and he was fine, and that was over 10 years ago, and he's still fine. So, I mean, so that helps with reproductive health. And to understand how that works, there was a muscle that had to be worked on, and it's called, along with this treatment, and it's called the pectineus muscle. And the pectineus muscle is connected to the lower part of the colon is the cecum, and the cecum organ, which is between the large intestine and the rectum, is connected to the pectineus. And then pectineus muscle needed to be worked, and then from my understanding what happened is once the pectineus started to function, then the pubic bone came up a little bit in its balance, and then the testicle came right back over there, and it was just fine. So that was it. So that's how that works. So any of the muscles can be worked on in the body, and about 2 years ago I learned that the gluteals were really important in balance, and so I started working on that, and I learned that you could work on the gluteals connected to this hand and foot bone stuff. And so I did, and then it did help strengthen the lower extremity. It helped strengthen the face, where it would move better, because the head moves with the pelvis, and the pelvis moves with the head. So basically, for autism, a lot of times they don't have a lot of facial expression. They don't smile a whole lot. They don't use their face muscles. And so the gluteal muscles, by working on those, then that would help to smile, and then your cheeks would move better. So that's how that works. And it takes several visits to unlock it. So like for getting the inner and the outer part moving properly and doing the other technique related to it takes 4 visits to work on one muscle of the buttock that's not moving properly.